We have always tried to be balanced. Whatever it is that we do in terms of measures, it has to be based on evidence. We look at the number of infections, the positivity rate, and the number of beds. So your need to party and be free and go about not wearing your mask has to be balanced against the need of someone who will be deprived of care because we simply have no beds. My conscience is clear that we have done all that we can in balancing lives and livelihoods. At this stage, the equation and the balance has now shifted to saving lives. We are all free people in Jamaica. Freedom is paramount. Freedom is the ultimate. Freedom is the Jamaican dream. However, we are not free to be irresponsible. With great freedom comes great responsibility. And as a citizen of this country, you have a responsibility, more than enforcement, more than compulsion, but a duty to follow the law. So, we are now in the danger zone. The numbers will continue to rise. It is the nature of the pandemic. I don't like to, call down the worst. But if we do not get these numbers down, it is likely that the mortality rate could also rise. So, in this phase of the management of the pandemic, the government has to remain strident. It has to remain resolute in the measures that we have implemented. And I wish to prepare the Jamaican people that if the numbers do not improve, then, as I had said earlier, there are other measures which we will put in place. These measures will have an impact on the economy. It will have even greater impact on your ability to move. It will have even greater impact on your ability to gather. It really depends on what you do at this point. Some of you would have seen reports that we are now, for example, having challenges with oxygen tanks. You would have seen reports of persons going to the hospitals and not being able to get the treatment they require. Indeed, unfortunately, some have died. I've gotten the first-hand reports of persons who have gone to the hospital, having breathing challenges, showing symptoms of COVID-19, and were pointed to other hospitals because the hospital that they have gone to just simply had no beds. And there is a sense that this could not happen to me. Indeed, when we see the videos of people keeping parties in this period of time and people enjoying themselves, the sense that you get from it is as if to say, I am invincible. This couldn't happen to me because I am not in the vulnerable age group. You may very well not be in the vulnerable age group, but your grandmother is. The people that you work with are. Those that you take the bus with are. This kind of selfishness cannot be allowed to continue in our society.
We are here to hand over the 50,000 vaccine, AstraZeneca vaccine, that is promised to government of and the people of Jamaica by government of India and people of India. And this is a moment, occasion where we have received this afternoon, and I am happy to be a part of this ceremony?
Well, I'm very much looking forward to receiving this kind gift from the government of the Republic of India. Earlier this morning, I had a conversation with the Minister of External Affairs of the government of India, Minister Jai Shankar, and one of the things we discussed was, of course, our pleasure and appreciation at receiving these vaccines today. So it will be good to start our program, and it is good to start our program in the spirit of friendship and partnership that exists between ourselves and the government of India. There are, as at last week, there were, I think, 120 countries out of the 193 in this world that had not started their programs yet. The other countries in the Caribbean had received theirs from a gift that one country had received on the terms that we were not a part of. And that other countries weren't either in CARICOM. You know that CARICOM put out a statement for that very reason. It is not an even playing ground out there, and we have been doing our best, and not only doing our best, but doing as best as is possible. Even the great country of Japan only started their vaccination program last week. So it is not I think it has been said before that vaccines are not a shelf item. There's an extremely complex dynamic out there. What is good to focus on is that we are in fact going to start our program this week, and our partnerships with all our country cooperating partner countries remain strong.
Minister, will you be first in line to get the vaccine?
No, I'm not a health worker.
Okay. And you're not interested?
But I'm ready, of course. I'm ready, my husband is ready, my parents are ready, my family is ready, all of us are ready. It's just that we all have to wait our turn.